We're all here today to talk to the public, and particularly those in the Fraser Health Authority, about the appalling state of emergency room care, and we are very concerned about what's happening with patient care in the entire Fraser Health Authority emergency room environment. Some have been in chaos recently, with emergency rooms overflowing with seriously ill people. Excessive wait times for patients needing to be assessed, patients needlessly suffering and sitting in emergency room chairs in pain, nurse-patient ratios that have hit an all-time high. This is not safe patient care. In the past few weeks, Fraser Health Authority has gone to great pains to reassure everyone that everything is okay, that we can fix it, that people aren't being nursed in hallways, that we've eased congestion. I'm here to tell you that this is simply untrue. The Surrey Memorial Hospital has just reopened its old emergency room. That's right. Taxpayers spent hundreds of millions of dollars on a shiny new hospital and ER, and it has been over capacity since the day it opened. This past week, patients have been put on stretchers in hallways. They were waiting up to 6 hours just to be triaged. On Sunday, a backlog of 78 patients were stuck in the emergency, unable to get a bed on the wards. Fraser Health apparently never planned on an increase in patients. They're saving money by not opening more inpatient beds and hiring more nurses. But patients are paying the price.
Since the opening of the new emergency, I have been inundated with emails, phone calls, text messages from nurses that just cannot cope. They're emotionally and physically drained. At triage, they have 60 people at a time waiting to be secondary triaged. One patient who we spoke to on Saturday had been admitted to the emergency and had been on a stretcher in the department for 3 days. Another nurse said to me, "It is not safe. Sometimes I'm unable to see my patients for up to 4 days. It's emotionally taxing. I'm ethically and morally concerned for my nursing practice and my license since moving to the new emergency."
The horror stories abound, not just in Surrey, but also at Royal Columbian, Eagle Ridge, Abbotsford, and Ridge Meadow hospitals. At the Royal Columbian on Tuesday, there was a patient who had been diagnosed with an antibiotic-resistant superbug wandering around the emergency room and into the Tim Hortons coffee shop. And as you know, MRSA is highly contagious, and patients are generally isolated.
Chronic congestion has created a feeling of helplessness amongst the nursing staff. It also has a profound and negative impact on the professional and, equally as important, the personal lives of nurses. Nurses are exhausted and stressed from the effect of chronic congestion. Together, this is a significant threat to the deliverance of safe, quality patient care and, of course, safety of the nurses delivering that care.
In response to the issue of congestion, our nurses are told, well, your union doesn't want patients nursed in the hallways on the floors, so we're going to keep the emergency room over capacity. How ridiculous and lame an excuse is that? Of course we don't want patients nursed in hallways on the nursing floors. They don't have the staff, they don't have the equipment, the patients don't have the privacy, they don't get the care they need. But to say then that that's the cause of congestion in the emergency is simply ludicrous. In Abbotsford Hospital, a pediatric psych patient, a child, was forced to lie on a bed in the emergency room for more than 100 hours. 4 days that child waited to get an appropriate psychiatry bed.
Abbotsford Regional Hospital has been at an overcapacity level for a very long time. We have basically, on a daily basis, 30 to 40 admitted patients on stretchers and on chairs. We also have admitted elderly patients who are either in their 80s or they're 90 years old, sitting in recliner chairs or stretchers, waiting in excess of 4 to 6 days in a busy ER department that does not shut down or dim lights. We care for in the emergency department cancer patients up to 4 days, compromising them because they're not being able to be isolated properly.
Recently, we learned of a man in Eagle Ridge who waited 5 days in emergency to get a bed on a ward, and another who went into a code blue, meaning a cardiac arrest, while still sitting in the waiting room needing to be assessed. There was a man who had his last rites read to him by a priest in the hallway of Abbotsford Emergency in front of 12 strangers. And CTV told us the story of the woman whose appendix burst while waiting in Surrey's new emergency for 12 hours. This is obviously unsafe patient care. It's unacceptable to nurses, and it should be unacceptable to Fraser Health Authority and the taxpayers of BC. We are demanding that the Health Authority take immediate steps to find long-term, permanent solutions to overcapacity problems, not Band-Aid fixes that temporarily relieve congestion. Funding is needed for more inpatient beds, and by funded I mean staffed. Nurses believe the problem stems from an ongoing attempt to cut and reduce operating costs. But the net effect is to cause additional pain and suffering for patients in their greatest time of need. Patients and taxpayers deserve better, and at least they deserve honesty and transparency from the Health Authority management. It's unacceptable for the 9 vice presidents of Fraser Health Authority to stand in front of the public and say that we are coping and all is well. We are not coping. It is in chaos and all is not well. Fraser Health officials need to get out of their boardrooms, stop doing happy photo ops in shiny new buildings, and go see the chaos that's happening every day in the emergency rooms in their health authority for which they are responsible.